Welcome to Bioverse. Explore health, medication, and beautiful world of biology.
Hello and welcome. Today, we are going to explore the various methods of medication administration, a crucial topic for healthcare providers, students, and caregivers. Medications can enter the body through multiple routes, and the choice of route depends on the drug type, desired effect, and patient condition. There are three primary routes of administration: enteral, where medications enter the gastrointestinal system; parenteral, where medications are injected directly into the body tissues or bloodstream; and topical, where medications are applied to the skin, mucous membranes, or even the eyes. Fun fact: some medications are versatile and can be administered in more than one way depending on patient needs. Let's start with enteral administration, the most common and cost-effective method. Oral medications, PO, are practical, but the effects may take 30 to 45 minutes to appear because the drug needs to reach the small intestine for absorption. Drawbacks include slow absorption, irritation of the gastric mucosa, unpleasant taste, and reduced effectiveness in critically ill patients. Oral medications should not be used in patients who are vomiting, unconscious, or have swallowing difficulties. Tip: liquid medications are often administered with a special orange oral syringe, which prevents accidental injection with a needle. For patients unable to swallow, medications can be given through oral gastric, nasogastric, or percutaneous endoscopic gastrostomy tubes. Administer drugs using an orange catheter tip syringe or oral syringe. Always flush the tube before and after to ensure proper delivery and prevent clogging. Keep the patient's head elevated to reduce the risk of aspiration. Next is parenteral administration. The intravenous route delivers drugs straight into the bloodstream, producing rapid effects. IV medications can be given as a continuous infusion or a single bolus. This method allows for precise dosing and is preferred in emergencies. Caution: IV drugs have a higher risk of adverse reactions, infection, and local irritation. Nurses must follow aseptic techniques and monitor patients closely. Tip: IV therapy is often used for antibiotics, fluids, electrolytes, and emergency medications. Intramuscular injections are given into the muscle tissue, which has a rich blood supply. Absorption is faster than subcutaneous injections. Large muscles reduce irritation or pain. Some medications are prepared as depot injections, which release the drug slowly over time. Tip: rotate injection sites to avoid tissue damage and discomfort. Subcutaneous injections are delivered into the fatty layer beneath the skin. Slower absorption makes this route suitable for insulin, morphine, and heparin. Only small volumes, less than 1 milliliter, can be administered. Clinical tip: pinch the skin before injection to reduce pain, and rotate sites to prevent bruising. Intradermal injections are given into the dermis, rarely used for systemic medications, commonly used for allergy tests or MAN2 tuberculosis tests. Tip: inject at a 5 to 15 degree angle to form a small blab under the skin. Do not massage the site after injection. Intrathecal injections bypass the blood-brain barrier and deliver drugs directly into the cerebral spinal fluid. Commonly used for epidural anesthesia or chemotherapy targeting the CNS. Always monitor neurological function after administration. Intra-articular injections deliver medication directly into joints, often used for corticosteroids or contrast dyes. Procedure usually requires imaging guidance to ensure correct placement. Tip: advise patients to rest the joint after the injection. Topical medications act locally on the skin or mucous membranes. Cutaneous, creams, lotions, antiseptics. Transdermal, patches that deliver medication slowly over time, nicotine, anti-anginal, or hormone patches. Tip: clean and dry the skin before application and rotate patch sites to prevent irritation. Some drugs are absorbed through mucous membranes, offering local or systemic effects. Sublingual, under the tongue for rapid absorption. Buccal, between the cheek and gums. Intranasal, sprays or drops absorbed quickly via nasal tissues. Tip: avoid eating or drinking immediately after sublingual or buccal administration. Rectal, PR, useful for nausea, vomiting, unconscious patients. Slow absorption makes it ideal for overnight analgesia. Vaginal, PV, includes pessaries, foams, jellies, and creams. Provides local effect and allows self-administration. Clinical tip: educate patients on proper insertion techniques for comfort and effectiveness. Sublingually subling. Medication is absorbed straight into the systemic circulation and does not go through the stomach, even when it is put in the mouth and under the tongue. Example, sprays, lozenges. Between the inner linings of the cheeks, gastric acid typically quickly metabolizes any sublingual or buccal medication that is swallowed. Buccally, between the inner linings of the cheeks. Intranasally, through an aerosol or drops administered to the nose, where the nasal tissue's vascular network quickly absorbs the drug. Rectally, where it might have systemic antiemetic and local evacuation suppositories effects. Benefits include its applicability for people with severe inflammatory bowel disease, nausea, vomiting, difficulty swallowing, and unconsciousness. In contrast to oral preparations, whose effects often fade by the next morning, the slow absorption of anti-inflammatory medications makes this route ideal for administering analgesia overnight. Self-administration may be challenging for certain people. Suppositories can cause anal or rectal irritation, especially after prolonged use, and the presence of feces in the rectum disrupts medication absorption, making it irregular and unpredictable. Vaginally, PV, pessaries, foams, jellies, or creams are among the preparations that are put into the vagina using a specialized plunger. The ability of the individual to self-administer is one benefit of this approach. The effects are usually local and the onset is gradual. Conjunctival administration involves eye drops or ointments. Short contact time with solutions. Ointments may blur vision. Gently pull down the lower eyelid to form a pocket before applying. Avoid touching the eye with the dropper. Otic medications are delivered as drops or creams into the ear. Tip: tilt the head so the affected ear faces upward. Warm the medication to body temperature to reduce discomfort. Inhalation. Rapid absorption is made possible by the lungs' large surface area and blood flow. This method is used to administer bronchodilators, anesthetics, oxygen, and mucolytics. A percentage of drugs that are inhaled will enter the bloodstream and may result in adverse drug reactions, ADRs. For example, salbutamol can cause tremor. Intra-ocular drug delivery uses a disc similar to a contact lens. Slowly releases medication for conditions like glaucoma or post-surgical treatment. Advise patients not to rub their eyes and monitor for irritation. And that concludes our comprehensive guide to the routes of medication administration. I hope this video has helped you understand how medications can be safely and effectively delivered through different methods. Remember, understanding these routes is essential for safe patient care and effective treatment. If you found this video helpful, don't forget to like this video, share it with your friends or colleagues, and subscribe to our channel for more detailed medical and nursing tutorials. Thank you so much for watching, and stay safe and informed.